Los originales Community Health Worker Radio.
Buenos días a toda mi gente linda. Habla la doctora Ileana Ponce. Les estoy invitando a que escuchen mi programa todos los lunes de 1:30 a 2:30 p.m. hora de los Estados Unidos, Pacific Time, aquí en Los Originales CHW Radio, la única emisora en español dedicada 100% a los Community Health Workers los 7 días de la semana, las 24 horas del día. Gracias.
Hola, muy buenos días, mi gente linda. Hello, everyone. Today we are going to have a English program, and we are going to have talking about influence here, talking with Dr. Ponce in Los Originales CHW Radio. Well, it's my pleasure for me to have two important guests, both of them working with the Washington Department of Health, and I wanted to give in the welcome to Barry. Hi, Barry. How are you?
Good. Thank you for having me today.
Yes, Barry, can you telling us what is your position in the Washington DOA and why you are here today?
Yes. My name is Barry Iverson. I am a health educator with the Washington State Department of Health, and I specialize in running and educating people about flu campaigns and prevention campaigns, and a lot of the things that go along with that, the partner engagement, educational material, resources, and connecting people so that we can prevent flu illnesses in Washington.
Thank you, Barry. I wanted to thank you to Barry because he is very busy. However, for him, it's very important that our community is still informed about what is happening in the Washington state, not only in the Washington state, but in all country, about the importance of the vaccine for influenza and the importance of the vaccination. And today also we are going to have another guest that she also is a colleague with Barry, and she is Morgan. Morgan, how are you?
Oh, thanks for having me today. I'm doing well.
Yes, Morgan, can you telling us what is your position in the Washington Department of Health and why you are here today?
So I am also a health educator with the Center for Public Affairs at the Department of Health. I do health education work focused on COVID-19 vaccine, and then I'm also a generalist. So I work with a lot of different health topics. And over the last year, I had the opportunity to work on the think of it as essential flu campaign for the state.
Thank you, Barry. We have a very, very good relationship with Barry and Morgan. We wanted to thank you for all the wonderful job that Washington DOA through you doing for our community. And before we start with the question, I wanted to talk a little bit about the history of influenza, or much better life flu. This is a disease that is with us for longer. We have more than 400 years with this epidemic. I don't know for many of you, what is the difference between epidemic and pandemic. Epidemic is when we have a disease and it's only predominant in one city. But when that disease is going to affecting other country, it's not only epidemic. At the point that it's affecting all the world, then we're talking about pandemic. This, like for example, COVID-19 pandemic. The first place when the influenza was discovered was in England in the 16th period, the 16 or the 18 in the USA. And that was when we recognized influenza. And the name coming from the star, they related that the influenza was something related with the stars, and the worst was in 1918 when that caused more than 20 million of people was dying. And this is, we can compare this only, maybe with the COVID-19, and thank you for the vaccine, the pandemic or the epidemic, so this disease have been under control. But talking about this, I wanted to talk with Barry first. And Barry, can you telling us why it's important the Department of Washington is working with communities like Community Health Worker Coalition for Migrant and Refugee to giving the message to the population about what is important to get the influenza vaccine. And this year, I know you have a contract with more than 40 different organizations in the state. Thank you.
Thank you. Yes. So it's very important. Community health workers play a very important role in public health, especially with preventing influenza illness. And there's always so much information that people need to receive, accurate information to make the decision to prevent this illness through vaccination. So the Department of Health is very proud to make these lasting relationships and be engaged at the community level, because it can't be done without community health worker help. It just can't. People that understand the communities and understand the health needs at the local level know this work better than anyone. They do more thoughtful and meaningful work than we at the state could ever do in the position we're in. So we leverage what we have to make these connections so that the work can be done, and that we can make sure that everyone gets the right information at the right time.
Thank you, Barry. And we truly appreciate, we wanted that you be like example for other grantors and for other funder organization and institution, that the way that you have been accomplished great thing is because you really listen to the community. And this is something very good, that the department is doing. You have done a lot of contact with the community-based participatory research. And this is the way that I believe this stage is one of the first stage, when the vaccination 70% for all the population in COVID-19 was, because really the department is working with the population. And Morgan, telling us what is the successful about this campaign compared with the other, how the Department of Washington is measured successful against the influence in this year.
Yeah, so one thing that was unique this year is that we had this special funding specifically to focus on communities who are disproportionately impacted by influenza and also by COVID-19. And so that includes populations with low influenza vaccination coverage, and then, like I said, populations at risk for complications from both flu and COVID-19. This grant allowed us this year to provide funding to community organizations to really use a community-rooted approach, like Barry was saying previously, such as providing services in the primary languages that community members speak, and also providing services in locations that are accessible to communities. So, this funding really allowed organizations to provide, tailored, unique services that would really reach their populations.
Thank you. And Barry, how was the success of this campaign compared with the last campaign that you have for years? Like, for example, how many people get infected this year with influenza, and how many people have been dying for influenza?
Well, that's a very interesting question. This year this past flu season was unlike any most of us have ever seen. It's when it comes to hospitalizations, for example. So it's important to note that flu is a very underreported illness, and not everyone who feels sick with flu-like symptoms seeks out medical care. In fact, most people can care for themselves at home, but those who do get concerned about their health and go into a healthcare provider facility or a hospital to seek care, they're usually feeling very sick and very worried. And so, but some people have to remain in the hospital, others are sent home, and not everyone who goes in has flu. But the amount of people that go into hospitals or seek out care every year ranges from multiple hundreds to thousands to tens of thousands in Washington state. And so it's really hard to put a number on just how many people go in. But even in a year that we just had, where we actually didn't have any reported deaths in Washington this year, but we still had people going to healthcare providers and reporting that they felt that they may have flu. And so while the COVID precautions, things like not being in school and not traveling, masking up and vaccinating, because we still had very high vaccination rates, all worked together to help keep flu season relatively mild this year. So as far as our campaign efforts, we feel that the work was very successful in working both on this campaign and previous campaigns, because there was a lot of extra worries, as you well know, with COVID-19. A lot of the safety precautions are the same for both illnesses, but they are very different illnesses. So we're really happy to have seen no deaths this year, and we really hope that continued efforts of prevention and healthy habits and vaccinations, of course, continue to become normalized, and that people continue to do the best thing for themselves and their communities by talking to local trusted sources of information, so that the work that we've began and that we did so well on this year will continue.
Thank you, Barry. I wanted to read some of the nice comments that we getting from our audience. I wanted to thank you to everybody that is with us today: Veronica Diaz, Araceli, Claudia Padilla, Melissa, and also Kathleen. Veronica say thank you for all the information that you given to the community, and Kathleen say everything that is good for COVID-19 also protect us from the flu. And also, I wanted to say, Barry, that like you say, it's very difficult not to say how many people have flu, but compared with other year has been an improvement because the campaign that you have done, and also there had been no death this year, no, as what I understand in the state, and that is why you can measure. And like Kathleen say, what is good for COVID-19 is good for flu, because also the flu is another virus, and we have to keep in distance, using mask, clean the hand. And I believe the fact that everybody is doing, most of the people are doing this preventive measure is why we have been very successful. And also I believe the COVID-19 vaccine, and you, Morgan, let me know, do you believe that the fact that you start before the effort to start talking about the COVID-19, you was talking already about the influenza, that was very good, like a platform to start talking about the efficiency of the vaccine, no?
Sorry, I was on mute. Yes, I think because the behaviors that can prevent COVID are the same that prevent flu. People were kind of used to already doing, the COVID prevention behaviors, and so adding the flu messaging in there, flu vaccine, the importance of the flu vaccine, I think people were kind of used to that idea, and so potentially more willing, more likely to continue those behaviors to prevent flu.
Exactly. And like we hear from our Morgan and Barry, it's very important, to continue with our effort and taking the vaccine. There are a lot of people that get flu, but they don't go to the hospital. There are a lot of people, that because why I wanted to do a comparison, Barry and Morgan, and this is for both of you. If both of you wanted to answer, it's okay. But how you explaining that before, in the 16th century, everybody died? Was a very violent, the flu was a very violent death, 20%, they causing a lot of death at that time. And why now we don't see those death? It's sure that there are people that is more susceptible, people like elderly people or younger people that have chronic condition, and it's very similar, the susceptibility of the people with the COVID-19. But why now there are we don't listen that is a pandemic or epidemic of COVID of influenza? What do you believe is this?
I can start on this one. So you raise a lot of important concerns. One of the larger picture concerns is that people may not be aware of what history has taught us about the benefits of vaccination. Because vaccination has worked so well. And this is besides just flu, which has, like you mentioned, been around forever. Before vaccination, there was far more health disparities than we have now. And vaccination has made some diseases almost go away completely. So people don't see them, they don't hear about them as often anymore. And flu is one of the ones where it's been with us a long time. We've had vaccines for a long time. And usually people who do get vaccinated will repeat to get a new flu vaccine every year, which is the recommendation. However, when certain coverage levels, the amount of people that take it, it hasn't really changed for quite some time now. We have more work to do, and that's partly why the roles that Morgan and I play are so important, because there's always more work to do. We know that there's more people that need to get proper information and very helpful information to make the decisions so that we can get those numbers up even more. Unfortunately, leaving people being unvaccinated who are able to do so leaves them subject to a lot of very serious illness, disease, hospitalization, and even death, unfortunately. And we really, it's preventable. That's the most important thing that people need to know. Is most of these deaths that we see every year from flu are preventable. And we're really glad to see that the work that we began with flu vaccine for this latest campaign, like Morgan mentioned, it did begin before the COVID vaccine was available. And we're really hopeful that this work will continue into the next flu season, which starts in just a couple months. So that everyone that took charge of their health will continue to do so, and we can get the numbers for both vaccines to go up, because we all want to see a positive outcome.
Barry, thank you for bringing that. But like you say, there are many people that forget history. And we have to remember, what happened when there were no vaccine, for the influence. We lose a lot of people, there are a lot of either in the movies, about the pandemics and very sad history. And because now we have a vaccine, and it's one of the more successful vaccine, every year, people have to take in another vaccine and they don't get it. But I know many history about either young people, that die for flu because they don't take the vaccine, and they are family that start taking the vaccine until one member of the family die. Like you say, the benefit of the vaccine compared with not getting the vaccine is what we need to talk. There are many people there that they don't believe in vaccine in the state. This is good for them if they wanted to do that, but it's not right, because in public health we have to protect the people, and a virus transmitted from one person to another person. And if you think the vaccine is not good, you have to use a mask, you have to clean your hand and keeping distance and keeping yourself out of the other, because then I believe it's people that go outside killing people with the disease, because they maybe can survive by person that have a condition like cancer and leukemia. If they get a flu, it's almost as dangerous, and they get a COVID-19, they are going to die. And now in our efforts, the only thing that we have to do is to compare what is better, the COVID-19 vaccine or no vaccination or the influenza. Because Morgan, what are some consequences that you can telling us about what happens if I don't get the vaccine for influenza, for example?
Yeah, so everyone is at risk for flu. So, anyone can get it, even healthy people. So that's one reason why vaccination is so important. Like Barry said earlier, there's, hundreds, thousands of people who have to end up being hospitalized or report to the emergency room because they have, severe influenza-like illness. It also, spreads pretty easily between coughs and sneezes, and so, you can infect other people easily, and you can also spread it when you don't realize it. So those are some reasons why vaccination is really important. And then also, like we've been talking about, with COVID also going on, we really want to avoid people having not just one, but two, respiratory illnesses at the same time, which can be pretty harmful to their health.
Exactly. Can you imagine you get the influenza and then you have COVID-19? You are going to have less probability almost to survive. And although this look like it's not happening, that can be happening. And thank you for all the effort that Washington Department of Health do in supporting many communities like Community Health Worker Coalition for Migrant and Refugees to working with the community and getting information and getting the fact, ¿verdad? And getting for example, one of the things that I wanted to invite also, to our listeners that please ask questions. If you have any question, we have the expert today. We don't have it then every day, and it's very important for you to lead. But Kathleen, thank you, Kathleen Perez, and hello. Kathleen have a question. He say, how pervasive are myths about flu and flu vaccine?
I can take this one. That is something that I think every healthcare provider and every vaccine advocate has to face each and every year, is that it's very common, to answer the question, it's very common to hear myths about flu vaccine, not just the vaccine, but the flu illness. For one thing, there are people who really just kind of dismiss flu as no big deal. They don't think that it's, they just think it's something that we live with and have to deal with. But that's nothing could be further from the truth. The one thing that we do know about flu is that it is very serious, but it's also very unpredictable. And I will say that I can address one myth that we see every year and quite often, is that there is a belief from some people that the flu vaccine can cause flu illness, and that's absolutely not true. And so that's one of the biggest things that people can work to educate themselves on, is how vaccines work, not just flu vaccines, but all of them, if they are questioning the need to take one. So yes, to answer the question, the myths are very common, and sometimes it's a case of someone simply getting the information from someone who is not who isn't trained to give that information. So we want to recommend that everyone always talk to the healthcare provider or another type of trusted source of information who will where it's medically accurate information.
Thank you, Barry. And also, I wanted to remind people that the complication of the influence, in addition to what he answered, I wanted to tell you that the virus, when they go to our bodies, they can be more easy for a person to get a bacteria, and then is when you get the pneumonia. And everybody that have been the pneumonia, we know that many as people elderly. They can die more easily, but it's not only the pneumonia. They can give you sinusitis because the infection go through your system and affecting places like the sinus and also the endocardio, that is the heart. And this is why you have to be careful, because it's not mean that, oh, I get it and maybe nothing is going to happen. We see that in COVID-19. Some people get it and there doesn't happen anything, but other people get it and they don't survive. We have many community health workers that have losing a husband, a mother, or a relative for COVID-19. And we have other people that is asymptomatic and we never know. It's some pattern, the pattern is that it's people with previous condition, but not always. We see children that have dying for COVID-19, and children have dying also for influenza. You see youth people also dying for influenza. And this is why, and also for those people that say lie, I don't know why human being, and this is something that the Community Health Worker Coalition and this radio is doing, this is what we invite them to, is to believe in the fact. There are a lot of myths. There are a lot of false information. And please, I don't know why you believe the false information and you don't believe the fact. I say, the vaccine had benefit. Looking, what happened when 70% of the population have been not vaccinated and stay? We have a lot of people dead and sick. Now we have a 70%, and we see the changes now. No, our governor said you cannot use masks, but also everybody that have the vaccine, I wanted to telling you that not having the vaccine is not also protecting you about getting again the disease, okay? Because there are different variants, and maybe we are going to need to taking another vaccine, like similar to influenza. Every year we need a reforce. And please, if you are in a place that is closed and you don't know if everybody have been vaccinated, it's better for you to still doing the precaution for that. Before we continue, we wanted to go to some commercial. And thank you, and we're coming back soon.
Hola mi gente linda, esta es la doctora Ileana Ponce González, la directora ejecutiva del Community Health Worker Coalition for Migrant and Refugee, y los invito a que me escuchen todos los lunes de 1:30 a las 2:30 desde los originales CHW Radio, la única emisora en español desde la ciudad de Edmond, Washington, las 24 horas del día, los 7 días de la semana. Hablaremos de todos esos temas importantes de salud que afectan nuestra comunidad, especialmente para todos ustedes, los Community Health Workers. No se la pierdan, los esperamos. Gracias.
Hola, mi gente linda. También quiero decirles que tenemos transporte gratuito para vacunarse. Si necesita ponerse su primera o su segunda dosis, solo llame a Jacqueline al 206-291-2599 o a Marta al 240-551-8969. Y no se olviden de escucharnos también por Amazon Alexa. Solamente tiene que decir, solo di Alexa, abre los originales CHW Radio. Y volvemos. Thank you so much for being here with me, Morgan and Barry. Thank you so much. It's a great pleasure to have both of you here. I want now to asking you, Morgan, how many organizations are working in this effort to give the message that the population need to hear about the importance of the vaccine, the fact about how to enhance COVID-19, and why? How many organizations, and how you selecting the organizations?
Yes, so with this grant, we are specifically working with about 11 recognized American Indian organization tribal partners, and then 6, I believe, community organizations specifically focused on enhancing and increasing influenza vaccination. So we chose applicants based on a project proposal that they submitted. There was a whole menu of ideas that organizations could choose from to enhance influenza vaccination, whether that was partnering with vaccinators at other agencies or creating and leading social media campaigns, leading community health fairs. There's all sorts of, innovative ideas that community members could choose from. And so it's been really a privilege to see the creativity and also, the amount of flu vaccines community members have gotten as a result.
Yes, thank you. I'm very. These forces are going to finish this year, or you continue these efforts in the coming years. What you are planning?
Well, I will say that whether we receive special funding for certain things or not, our efforts do continue every year. And that's all the more reason why these partnerships that we establish with the opportunities we have continue, and that people carry on this good work. Um, as much as possible, because this isn't something that we can do one time and hope that and then move on to something else. We need to continue these efforts. We need to continue working together. And so far, I think that we're off to a great start. This last year's opportunity has given us a good base for some new collaborations, and we hope our ongoing collaborations.
Thank you.
Yeah.
Thank you, Barry and Morgan. I'm talking about this collaboration. I wanted to present one of the video we were able to do and talking about what Morgan said. No, they're giving the ability for us to be innovative and cultural and linguistic appropriate for our community. This video is by Silvia Maceda, that she is a tricky Mixteca, and for another member of the population, our Garifonas from Honduras. Please check out the video, and thank you. And this is one of the sample what organization like Community Health Worker Coalition for Migrant and Refugee was able to do it with the support of the Washington DOH.
Hola, bueno, soy Silvia Maceda, promotora de salud de la Coalición de Trabajadores de Inmigrantes y Refugiados. Quiero entregar este breve mensaje para mi comunidad sobre lo importante de la vacuna de la influenza. Como todos sabemos que la vacuna necesitamos vacunarnos una vez al año para evitar enfermarnos y hasta morir. Por eso es importante hacerlo. Y también te recomendamos que esas vacunas pues te salvan tu vida. Por eso este mensaje es atraído por parte de la Coalición de Trabajadores Comunitarios de la Salud en colaboración con el Departamento de Salud del Estado de Washington. Entregamos este mensaje para todos. Gracias. Bye.
This is a message, from Sylvia, and they say, get the vaccine, you need 1 per year, and the children need 2 per year, and the vaccines are stay live. And I know that there were many different languages, no, that you, like the tribes, they also have the opportunity, no, to talking with the elderly and do message that are cultural and linguistic appropriate. What is, Morgan, so important that those program will be running for community health worker and not for the Department of Washington?
Can you repeat that question? Sorry.
Yes. What is important that this message are being given to community to be running from the community and not for the Washington Department of Health directly?
Yeah, that's a great question. So we know that people are more likely to listen to and take in information and trust information that they receive from trusted community messengers. And so that's why it's really important that we can have projects like this, because we the people who deliver these health prevention messages are familiar with the community. They work in the communities where we're providing services, and there's cultural awareness, understanding of culture, that sort of thing, and that's really important.
Thank you. I wanted to also to welcome to Claudia and Susanita that we have in line, and Maria and Araceli Mercado. I wanted to invite each of you to ask questions. If you have any question, we have 2 experts from Washington DOA, Barry Iverson and Morgan Jade, and they are here with us and not Yeah.
Buenos días a toda mi gente linda. Habla la doctora Ileana Ponce. Les estoy invitando a que escuchen mi programa todos los lunes de 1:30 a 2:30 p.m. hora de los Estados Unidos, Pacifico Time, aquí en los originales CHW Radio, la única emisora en español dedicada 100% a los Community Health Workers los 7 días de la semana, las 24 horas del día. Gracias.
Bueno, volvemos. Tuvimos algún precáncel con el sistema, no sé si por el calor, aunque no creo que está muy caliente afuera. Algo pasó con we don't know what happened, but we have some problem with the internet, and thank you for being here. And we have today Barry and Morgan. Morgan, what is the message that you have for our community today? For example, what you wanted to do to those people that is still not getting the message to get the influenza vaccine? What is the most important for you, for them to know?
Yeah, that's a great question. There are several things that I think are really important to know. One, again, it's recommended for everyone age 6 months and older, including pregnant people. It's available at no cost to everybody. So youth 18 and under, it's covered for everyone who's a youth across the state. And then also folks who have health insurance and even those who are uninsured. So it's widely available. It's something really important that you can do for yourself and also your community.
Wow, this is wonderful. It's free for all the children and women pregnant and the youth, more of the insurance take it. But I believe either if the people doesn't have insurance, they can have it. No, we have one question. Dice, Kathleen, what kind of individual people do combat misinformation and disinformation about vaccine? This is Barry. Can you helping us with that?
Yeah, I think one of the best ways that everyone can help to fight against disinformation is by getting vaccinated themselves and sharing the reason of why they did it. Lead by example. The more people do fear things that they don't understand, and that is very true. That people who, like, for example, are scared of getting the vaccine because of information that they've heard, because of information that isn't probably accurate. If they talk to a good friend or a close family member who has gotten the vaccine, and that person can be a very positive influence on them and then the people that they talk to. So I think walking the talk, for example, of is the best way to fight against disinformation is by speaking from personal example.
Thank you so much. And also, I wanted to mention, in addition to what Barry said, all the benefit that we get from getting the influenza vaccine. One of them is that every year they prevent a lot of emergency visit and also death. For example, in 2019 and 2020, they prevent 7.5 million of cases of influenza. And this is based on the statistic for CDC. And also, they prevent more than 105,000 hospitalization and more than 6,000 of death. This is the number of people that will be die or be in the hospital if we don't get the vaccine. And remember, everybody need to take to get the vaccine, because if we have a less than 70% in the community, the rate to get it, the infection is high. And this is, we are a living proof of the truth of the science, because now that the state have a 70% of COVID-19 people vaccinated, people is, we don't hear like before, all the people and all the cases that are dead. This is why we invited. And also, another thing is the sequels. All the diseases, if you get pneumonia, you are going to be propense, to get some allergies and some diseases. And we see that those depending on the infection you have, when you have pneumonia, you can have it in other system like the kidneys and the heart, and you maybe will becoming a person that is going to living with a chronic condition. You don't want it to be a person that we have only one heart, and your heart is not healthy. You are going to living with this disease forever. This is why you have to know all the benefit and get it or not get it, the influenza vaccine. And then, Morgan, this is for you. What is the difference between COVID-19 and influenza? Or they are similar? And I know that Barry, you are going to help into. Both of you are there in the public health arena. You are the expert, and you are there helping the community to overwhelm condition like COVID-19 and influenza. But based on your experience with COVID-19 and the influence, what is thing that you wanted to tell about the influence with the COVID-19?
So what I would iterate is that influenza and COVID, they're both viruses, but they're very different viruses. And, they're both respiratory illnesses, and they can cause very similar symptoms to one another. So sometimes people will get the flu and they think it's COVID, and vice versa. But they are very different. They do cause very similar, like I said, symptoms such as fever and cough and sore throat. So if you are, feeling sick, it is important to communicate with a healthcare provider and, ask them for their advice. And if you should come in, it's possible you'll get, antivirals if it's for the flu. But they are, very, very similar. And also, like we've been saying, the ways to prevent them are also very similar too.
I wanted to rewind. Thank you, Morgan. I wanted to rewind. Eduardo say, excellent, outstanding comment. Thank you. Thank you, Morgan. And
Yeah,
thank you,
I can add to that. Exactly what Morgan said, to take it one step further, is both diseases are now preventable through vaccination. And there's two different vaccines that you need. You need to prevent flu, you have to have a flu vaccine. And to prevent COVID, you have to have a COVID vaccine. They're both available. You can get both at the same time, actually, but they only protect against those viruses. So people that get colds and things like that, they're not going to protect you against those. There's no vaccine for the cold yet. But it's important that people understand that these are two different viruses, like Morgan said, but they are both preventable with two different vaccines that you can get together. And so as we approach the next flu season, it's really recommended that for those who have not yet received a COVID vaccine, don't wait, vaccinate right away for that. But if you're still one of those people that, you're still trying to make up your mind, try to talk to someone right away. And if it comes down to it and you get a flu vaccine and you haven't received your COVID vaccine, please get it at the same time as that if you're one of those people that wait. But the best advice is to not wait and to vaccinate.
Barry, thank you so much, because I get a lot of questions related to that, and there are a lot of myths and misinformation. And that I wanted to repeat what you and Morgan just said. If you get the vaccine for influenza, it's going to protect you only with influenza. It's not going to protect you against COVID-19. If you get a vaccine for COVID-19, it's going to protect you only about COVID-19. It's not going to protect about influenza. Both diseases are preventive. Both are we have a vaccine, and you can take in both vaccine and nothing happen. And then the only way you can be protected against COVID-19 is taking the COVID-19 vaccine, and the only way to be protecting with influenza is to taking the influenza vaccine. Thank you so much. I wanted to ask a question that I always get it about women that are pregnant. They have two questions. One of them is, I am pregnant, is safety, and is safety is it during the first trimester, the second or the third? They are 9 trimester for delivering a baby, and women that are pregnant, they are very protective. And what do you recommend to women that are pregnant to take the influenza vaccine?
So yes, women or people who are pregnant can safely receive the flu vaccine at any trimester, at any stage of their pregnancy. It is also safe to take while breastfeeding, because babies can't get their own flu vaccine until they're at least 6 months old. So from the time before they're born and then after they're born, they're going to rely on their mother to protect them. And this is the best way a mother can pass on antibodies to the unborn baby and give the baby some level of protection from flu. And that's just a wonderful thing that people should know. Is a very, it's a wonderful thing that people can do when vaccination is not an option for the babies themselves.
Yeah, this is very important. People that is pregnant, they can protect the baby by taking the vaccine, the influenza, and the baby cannot take any vaccine after the newborn, after a 6 months. Then it's important that they taking. And Alina saying, thank you, it's a valuable information. And thank you, Alina. And we are going to see another of the video we were able to produce through this grant. I wanted people have this opportunity to see how we communicate with our Garifuna, and then we coming back with Morgan and Barry.
Mi nombre es Silvia Ellington. Soy promotora de salud de la Coalición de Trabajadores de la Salud para los Migrantes y Refugiados. Como todos saben, la vacuna de la influenza nos protege cada año de enfermar hasta morir, ya que la gripe puede ser mortal en adultos, mayores y niños. Por eso te recomendamos que te vacunes contra la influenza. También las vacunas salvan vida. Este mensaje es traído a ustedes gracias a la Coalición de Trabajadores Comunitarios de Salud para Migrantes y Refugiados y el Departamento de Salud del Estado de Washington.
Thank you. These are the beautiful, one thing that we love of this relationship with you, Barry and Morgan, is that you listen to us and you was able to us to working with community health worker. All our artists were community health worker, is people that is are leader in the community, and they were talking and they were the one that the community listening. I believe it's a very important information. This video will be online, and it's going to be only in Facebook and YouTube and our live. But because I have a both of you, I wanted to ask another question. Anyone can take the vaccine? People that have with treatment with cancer, do you believe they also need to take the vaccine? Because some people, they say, oh, I have a cancer and I am taking the chemotherapy and I feel very weak. What is the recommendation that you as expert ask about people that have cancer and taking maybe, the chemotherapy?
Yeah, so I can address that. There are I can answer this in two ways. Number one, it's important that people know not everyone is able to get a vaccine, even if they wanted one. So that's that's going to be a recommendation from their doctor. But there are some people who simply can't get the vaccine for one reason or another, and they rely on everyone around them, family, friends, coworkers, people in their community, to provide them with a level of protection so it keeps them safe. And then other people, people undergoing cancer treatments and chemotherapy are especially at higher risk for flu illness. And it is essential that they receive protection because their immune system isn't working the same as it normally would. So it's definitely something to listen to your doctor and follow all health advice that they tell you if you happen to be going through chemotherapy. And then also, to my other point, you don't necessarily know that the people that you are in contact with, either at the grocery store or even walking down the sidewalk, you simply don't know what they're going through and what level of protection they have. So doing the right thing yourself, if you are able to, does help those that you come in contact with. And I think that's very important for people to remember.
Wonderful answer. You hear? If somebody have cancer, they are very susceptible to get the disease, and it's very important for them to taking the vaccine. But not everybody is eligible to take the vaccine, and the best thing that you have is to consulting with your doctor. But if you are a patient with cancer or any other chronic condition, you are more susceptible, and it's very important that we protect them to you. And Morgan, in your experience that you have and very in communication, how effective are the campaign or communication and again this misinformation, campaign? One of the reasons that the Community Health Worker Coalition and Los Originales Community Health Worker Radio exists is because we noticed that, and we need to talk and talk and talk and talk and bring experts like you. But do you feeling that we are failing as health educator and educate our community and using the media like the misinformation is using, for example?
So I think, again, like we've been talking about, using community health workers, using trusted messengers, that's what's really going to help dispel information in communities. And so if anything, I think we need more projects like this, more opportunities, to really use a community-rooted approach, because you have the trust, you have the familiarity. I think misinformation spreads, on a larger scale when, there's more kind of anonymity and things like that. So when you, have a really tailored approach with health workers that you trust, I think that's going to help dispel those myths.
Thank you, Morgan. We have a comment from Duke's Dynamically. I am not sure I understand your comment, but it's about you, for a minute, step back from the narrative. Big media corporations are telling you will see that there is overwhelming evidence or coordinated attempt to divide and overthrow the free world. There are a lot of theories, no, Duke? And thank you for being there and your opinion. And the facts are the facts, and everybody can speak. But if you don't take the vaccine, you will going to die, or you are going to be sick, or you will get maybe the disease and survive and have a lot of sequel. And the beautiful thing is that we are human beings and everybody is smart, and we can take the decision based on what we believe and based on what we have. And Duke, everybody need to have a opinion and be respect, and we sincerely thank you to you for being here with us and sharing this information. And this is what we're trying to telling people. It's very important to know the fact, because there are a lot of things that is misinformation, and the media is great, but also we can have a lot of information that is not that. And I applaud the efforts of our founders, and not because you are our funding. The Community Health Worker Coalition for Migrant and Refugee is working with migrant refugee that is a population that is very susceptible. And one of these is because there is no health insurance. And sometimes either they wanted to take good health care, they cannot do it because they don't have health insurance. And It's like we were talking, because this is an international radio, we were talking with people like from Colombia, and they didn't have the COVID-19 vaccine. And they say, oh, if we get anything, I will get it. But we are here and we have a dose vaccine, and many people didn't want to take the vaccine. Lie is like that, no? We say lie is good, but the great thing is that most of the people that have been vaccinated, they have been controlling in the state, and we can see in the map now the the places when we have a lot of COVID-19 now is the places when they are very low successful rate of vaccine, unfortunately. And those places when suffering a lot, but now they are at 70%, they are now controlling. We are going to have our last commercial to put a Morgan and listen for the expert. Thank you so much. You are going to be listening for many people, and we have to telling our people what is the fact. What you say, Barry, about women that are pregnant, people that have cancer, and children. Is the vaccine, Barry and Morgan, safe for children or newborns, or at what age they need to take?
Yeah, so for children, everyone over the age of 6 months are recommended to get the vaccine. And in some cases, if it's the child's first time getting a vaccine, they may actually need 2 vaccines in the first year they've ever done it. So talk to the doctor will let you know about that. But other than that, it's generally once a year for everyone. And make sure that you get a new one every year, because it's updated for all ages to provide protection with the new vaccine every year.
Thank you for that. And Morgan, another question is also for you. If somebody believe had the flu, do they need to take the vaccine? There are some contraindication. I heard that if I am coughing and I have a fever and I haven't get the vaccine, should I get the vaccine or no? What I shouldn't do?
I will actually defer to Barry on that one if that's okay.
Yes.
Yes. So people who are, when the flu vaccine is available, and the new one will be available probably around September time.
Mm-hmm.
If you are currently feeling sick, you should wait until you're feeling better before you go get a vaccine. And even those, it is possible for those who get flu and then get better to catch it again in the same flu season. So the most important thing is, yes, you want to make sure that you're not sick, because you don't want to go around other people if you're feeling sick anyways. But you wait till you're feeling better to get the vaccine, and don't wait until it's too late. I want to take this last moment to mention one of the reasons why so many people stay away from getting a flu vaccine and who claim that it doesn't work is because they wait until everyone around them is already getting sick. And so it takes about 2 weeks after you get the flu vaccine before you are fully protected. And so during that time, you can catch the flu after getting a flu vaccine, within a couple days. And it's not the vaccine causing it. So don't wait too long. Get it by Halloween if possible.
Wow, this is great. You just touch one thing that is very important. Many people say, oh, the vaccine made me sick, but you take 2 weeks to get the immunity. And can be that when you taking the vaccine, you are sick, and then you get the disease, and you believe it's because the vaccine. And this is what happened. This is why it's important to bring Morgan and Barry, the expert in influenza and vaccine. And I really thank you to you. And I wanted to invite you next time, because I believe 1 hour is not enough to taking about the importance of get vaccinated, and because we are near to get the other flu season, then the recommendation is, if you are sick, keeping in house and coming back to take the vaccine later. And every year we need 1 resource for that, and it's your choice to get it or not, but you have to know the fact. You have to know what you're missing if you don't get it, and why you cannot miss it. We love you. We wanted you to be healthy, and we wanted, if you are a grandpa, we wanted that you enjoy your grandpa, your family. If you are a pregnant woman, we wanted you to enjoy your son. I don't want it to see, like I see many pregnant women get COVID-19 and losing the children, or let the children alone. And thank you. And with this, from los Community Health Worker Coalition for Migrant and Refugees, los originales de HW. Hasta la próxima, el próximo lunes. Thank you, Barry and Morgan. Has been a very good pleasure. And thank you to all these people that asked questions, made the comment, Doug, Kathleen, Alina, Eduardo, Melissa, and Jacqueline, and everybody that is in our comment. And if you wanted to see again, go to YouTube channel and Facebook. Bye-bye.
Hola mi gente linda, esta es la doctora Ileana Ponce González, la directora ejecutiva del Community Health Worker Coalition for Migrant and Refugee, y los invito a que me escuchen todos los lunes de 1:30 a las 2:30 desde los originales CHW Radio, la única emisora en español desde la ciudad de Edmond, Washington, las 24 horas del día, los 7 días de la semana. Hablaremos de todos esos temas importantes de salud que afectan nuestra comunidad, especialmente para todos ustedes los Community Health Workers. No se la pierdan, los esperamos. Gracias.